This is Amanda Bullard, and I'm here to discuss safe opioid prescribing, training, and implementation. The organizational priorities and core values include the mission of improving the health of the community by providing excellent healthcare resources, and the vision of helping people live the healthiest lives possible. The quality vision is to provide evidence-based, competent, compassionate care to anyone, anytime, anywhere. The QI committee is led by the Chief Nursing Officer, and the members include the Chief Medical Officer, an emergency room physician, emergency room nurse practitioner, a hospitalist, a staff registered nurse, an ER registered nurse, a licensed practical nurse, a pharmacist, a surgeon, a post-op RN, a staff unit clerk, a staff patient care tech, health information management representative, a detoxification unit director, and detoxification unit RN. The duties are to discuss the identified problem, brainstorm feasible and evidence-based solutions, and determine which members of the healthcare team should be on the pain team, complete the Plan, Do, Study, Act model, implement practice change, and monitor the results. The meeting structure will be an initial 1-hour operational meeting to initiate the procedural change, and then weekly half-hour meetings to review progress. They will meet in Conference Room A at 10 a.m. every Wednesday, and then they will have a quarterly meeting to discuss goals. The reason for including all of these members of the committee are because each have a specific role in the new policy change, which includes decreasing ER opioid prescriptions, decreasing the time length of prescriptions written on the floors, such as for pain or post-op issues, and increasing identification in the need for detoxification services and referral to those services. The issue is that poor prescribing practices have contributed to the opioid epidemic, including quadrupling opioid overdoses, with more than 130 individuals dying each day due to opioid overdose. The purpose of the project is to inform, educate, and equip opioid prescribers with the evidence necessary to safely and effectively prescribe opioids, identify signs and symptoms of opioid misuse or abuse, and refer to substance use disorder treatment as necessary. The action plan is to update the facility opioid prescribing recommendations and policy to be consistent with those for the CDC's new prescribing practices recommendations, and to prepare and institute prescriber training regarding updated recommendations and monitor all of this through monthly quality indicators. We should have minimal cost for this, really. It's just going to be more or less primarily staff time, and then because the training will be completed and placed on the facility education platform. The savings will be seen through a decreased number of readmissions to the hospital and decreased number of individuals at risk for overdose, therefore decreasing the number of people requiring multiple emergency room visits. The potential impact on outcomes are decreased opioid overdoses, individualized competent patient care, and also increased referrals to substance use disorder treatment when necessary. Performance data is generated by a report that is ran in the pharmacy. So the pharmacy will review all of the orders entered for opioids. That will be given to someone in medical records, who will then review the chart, looking for the data that's needed to determine how long the prescription was used for, if the pain team was consulted, if we complied with all the new rules and regulations set forth in the policy, and to report to any necessary departments in real time. So the goal of real-time reporting is to make sure that we don't go a whole nother week or month doing the same practices if we're not meeting our goal. It's so that we can address them in real time and hopefully turn the ship around a little faster. Additionally, other departments may be utilized to help medical records to review those charts. Performance measurement will include looking at the number of opioid prescriptions written. Basically, we want to compare the ones that's written in the last portion of the year, September 1st through December 31st, and compare those to the ones in the previous year and see kind of how we look there. Also, to see the number of opioid prescriptions that don't comply with the new process improvement measures, and then any patients who received a pain team consultation within the correct time frame. Our measures will be communicated to staff through the monthly staff newsletter and the Team Reach application, which is a digital application that sends out reports to the staff members and team that are on each nurse leader's Team Reach board. Leadership will be briefed weekly via email and may also require phone calls on occasion depending on the needs at the time. And patients will be made aware through informational signs that are hung in patient care areas. Staff will receive annual quality improvement education as well as one-on-one sessions with the team leader or CNO when necessary. Prescribers will undergo the specific safe opioid prescribing training immediately and then have refreshers as needed throughout the year. And the CNO hopes that this will develop increased self-awareness, feeling of ownership towards the new practice, and buy-in from staff, while also improving the process as a whole. It will be evaluated for effectiveness through the chart review and comparing those opioid prescriptions and whether or not they align with the new facility improvement efforts. And then the implementation of the new process will be evaluated via a digital and anonymous survey through SurveyMonkey. I appreciate your time in hearing my presentation.